Is fat repositioning better than fat removal for lower eyelid bags? When it comes to improving the look of tired, puffy lower eyelids, many people wonder whether moving fat around or removing it altogether is the better choice. The answer depends on your unique facial structure and aesthetic goals. Both techniques have their place in eyelid surgery, and understanding their differences can help you make an informed decision. Lower eyelid bags are caused by herniated orbital fat that pushes forward, creating the bulge under the eyes. This fat is normally there to cushion the eyeball, but as we age, it can protrude, leading to a tired appearance. The lower eyelid contains 3 fat compartments: lateral, central, and medial pockets. When these fat pockets herniate, they form the characteristic puffiness. Many patients also develop a tear trough deformity, which is a hollow or depression along the inner lower eyelid area that becomes more noticeable with age. Traditional lower eyelid surgery, called blepharoplasty, often involves removing the excess fat to eliminate the bulge. This approach can be very effective at reducing puffiness quickly. However, removing too much fat can sometimes result in a hollow or aged look, especially in patients who already have tear trough deformities or a downward vector of facial aging, where the cheeks have descended. In these cases, fat removal might make the under-eye area look sunken and less natural. Fat repositioning, on the other hand, involves moving the herniated fat from the bulging area into the hollow tear trough or other deficient areas. This technique aims to address both the puffiness and the hollowness at the same time. By redistributing the fat, surgeons can create a smoother, more natural contour that preserves facial volume. It is especially beneficial for patients with vector-negative anatomy, where the cheeks have descended, or those with significant tear trough deformities. Repositioning can be performed through an internal approach, which leaves no visible scars, or an external approach with a small incision along the lower lash line. The advantages of fat repositioning include maintaining facial volume, achieving a more natural look, and reducing the risk of hollowing after surgery. It can improve the overall harmony of the lower eyelid and cheek area. However, this technique requires a high level of surgical skill and experience. It can have a longer recovery time, with some swelling and swelling-related complications. In rare cases, there can be issues like double vision if the surgeon inadvertently injures nearby muscles. Fat removal is generally simpler and more predictable. It is suitable for patients with significant excess fat that needs to be taken out. The results are often immediate and straightforward. But the downside is that removing too much fat can cause a hollow, aged appearance, especially in patients who already have tear trough deformities or downward facial vectors. Once fat is removed, it is difficult to restore, so this approach is less forgiving if overdone. In recent years, there has been a trend toward preserving and repositioning fat rather than removing it. Many surgeons now favor a more conservative approach that combines both techniques, removing excess fat where necessary and repositioning the rest to improve contour and volume. The best approach depends on individual factors such as the amount of fat, the shape of your face, and your aesthetic goals. If you have large amounts of fat and want a quick fix, fat removal might be appropriate. But if you want to maintain a natural, youthful look and address both puffiness and hollowness, fat repositioning offers a more balanced result. It is important to consult with a qualified eyelid surgeon who can evaluate your specific anatomy and recommend the best surgical plan. Remember, every face is different, and personalized treatment is key to achieving the best outcome. In summary, fat repositioning is often considered superior for patients with tear trough deformities or vector-negative aging, as it preserves volume and creates a more natural appearance. Fat removal remains a good option for those with significant excess fat and no hollowing issues. Always seek a skilled surgeon who can tailor the procedure to your needs and help you understand what to expect. Your individual anatomy and goals should guide the choice, ensuring safe and satisfying results.